Good afternoon, Yorktown, and welcome to another COVID-19 community update. My name is Matt Slater. I'm the town supervisor for our great community. I'm joined today by a good friend of Yorktown's, the Westchester Consumer Protection Director, Jim Maisano. Jim, how you doing today?
Doing great, Matt. Happy to be here.
Thanks so much for taking time on your Friday. I just want to, before we get to you, Jim, I just want to give an update as to where we are as a community as we continue to deal with COVID. So I'm going to share my screen here real quick. And we're going to be over here, right on our community impact dashboard. Again, I keep talking about this. We continue to update this with all the important information that residents need. So as of the last time we received our share file, which was yesterday, we have 331 active cases, 29 new cases. And again, you can see based on the map, it's broken down by zip code. So if you wanted to see where what's happening in Mohegan Lake, 10547 zip code, 3 new cases with 48 active cases. But here's the good news I do want to share, and I hope we continue on this trajectory. You can see here, and I'm going to blow this up for us if I can. This is the active caseload for the town of Yorktown. And you can see we were on a very, frankly, scary trajectory there for a while. In the beginning of January, but we've done a great job once again coming back down from that high peak, and again today and yesterday we were right around 331 active cases as a community. But there's still a lot of work for us to do. It's not over yet, and that's one of the things I want to talk about today, which is, of course, I don't know, Jim. I don't know who you're rooting for. I'm cautiously optimistic for the Bucks, but I know there's a lot of Chiefs fans out there too. But it is Super Bowl weekend, but it is not a time, quite frankly, for us, as much as we may want to. I don't want us to get this false sense of security. So we have to continue to be smart. We have to continue to wear a mask, socially distant, not gather outside of your COVID pod. Those are really important things because, again, as I just showed you, as a community, that we're coming back down with those active cases. And we've done a great job. So let's make sure we stay focused on what we know works. I do want to provide a few more updates for us. High-risk sports were approved by the state of New York. And the people, I've been getting some phone calls about this. So the state's approved it. The county, in conjunction with neighboring counties that are in Section 1, they've put together a process for our school boards to approve it. It's my understanding, I know that Lakeland approved it. And I believe Yorktown either did or will be approving it for high-risk sports to resume. Now, it's important for also everyone to understand, again, this comes from the state. This is not, the local government doesn't set these parameters. These are all decisions that are made by the state of New York. And as we've seen, really from the get-go, the state of New York has been the sole decision maker. They simply provide the guidance for Westchester County, the county government, or local governments here, like municipal governments here in Yorktown, to implement certain policies or certain procedures. So again, important for everyone to realize that when it comes to COVID-19, there is really only one decision maker or one decision-making entity, and that is and remains the state of New York. And that also goes to vaccinations, and that's something that we're going to be talking about today with Jim Maisano, who we're very excited again to have with us. But vaccinations are, again, being monitored and are being managed by the state of New York. So we do have certain vaccination centers that we know are open. The Westchester County Center is open. There's the health department clinic in White Plains, which is open. And there's also, they just announced, Westchester Community College is going to be also a vaccination center. Now, we've been very proactive here in the town of Yorktown. We believe that there needs to be an approved vaccination center for our community, for Northern Westchester. From our standpoint, and I've been working very closely with our town clerk, Diana Quast, on this, it's simply unrealistic to ask our seniors and our elderly to travel on the highway down to the Westchester County Center in order to get that vaccination. And not to mention, we've also heard from many seniors and many of our elderly residents that they are really struggling in even getting an appointment because they are not as computer savvy as some of the other residents in our town and across the county may be. So we are still working diligently to try to get that site secured. Diana Quast, our town clerk, and I were with members of the Westchester County Health Department touring sites last week. We toured 4 sites here in the community of Yorktown, and we were just waiting for the necessary approvals in hopes of getting a vaccination hub established in northern Westchester. So we have not let up on those efforts, and we continue to work and partner with our friends on the county level as well as on the state level, and it's the state that's ultimately going to decide where these are allowed to go. So we're talking about vaccinations. Also, as a reminder, the state has, again, expanded some folks to get the vaccinations. That includes now taxi drivers and restaurant workers. They are now on the list to be able to get vaccinations. Again, not something that the county decides, not something that the town of Yorktown decides. These are decisions made by the state of New York. But the most important thing I want to emphasize when it comes to your vaccinations is that despite the fact that we know where the vaccination hubs currently are, you must have an appointment. You cannot just show up to either the county center, to the health department's clinic, or to Westchester Community College. You will not receive a vaccination if you just show up. So that appointment is crucial. And I'm going to share my screen one more time here, because on our website, we do provide this information, and I want to make sure that everyone at home, everyone at home also has it as well. And so that information, again, for those people who are looking to set up a time, it's right here in this box, vaccination information. So for those who, if you're watching this on our government access channel, our seniors, if you're watching this and you don't have a computer, you don't have access to the internet, please call 1-833-697-4829. That's 1-833-697-4829. That is the New York State COVID-19 vaccination hotline. That's where you get through and you make your appointment, again, with the locations that are here in Westchester County. For those who are more sophisticated and are able to go onto our website and utilize the links, again, come right down here and you'll see where you can sign up as well as get notified by Westchester County. This Westchester County COVID survey will actually notify you as well as to when you are able to make an appointment. But all those resources are right there on our website, so I just wanted to make sure we re-emphasize that to our residents. But we are here with Jim Maisano, Westchester Consumer Protection Director, and one of the things that we're talking about that we are really starting to hear a lot about are scams. And this is something, Jimmy, that you've come to our community before to talk about, especially for our seniors, to educate our seniors and to make sure that we know what we need to do to be able to prevent scams from happening within our community. And the vaccination is another avenue that people are utilizing.
Absolutely. So what we're seeing across the country, when it comes to the scams, it's very important to note that it's not like one scammer that's kind of operating as some house in Westchester. It's organized crime across the country, if not the world. The modern day scams coming by robocall or text or email, these are pretty sophisticated criminals at this point. And what we've learned, consumer protection across the country, is that they follow the headlines. So they have the same tricks and procedures and tactics on the scams. They just change the script. But what we're seeing is what used to be the scam during tax time is now the scam during vaccine time. And basically what they're doing is two things. They're trying to get your money, steal your money, and to steal your personal information, confidential information, and basically to achieve identity theft. So they just continue to shift into new strategies. And the vaccine scams are happening across the country. For instance, they're calling and saying, I can get you the shot. Either by robocall, email. If the email, they have a link in the email, very dangerous. Don't click a link on an email if you don't know where the email came from. That's the trick. They're basically saying, we can get you the shot. Or they're saying, we can move you up in the rotation to get the shot. So they're trying to manipulate people, take advantage of them. The bottom line is kind of what you already get into, Matt. And that is the only way to get your vaccine is to go through the normal chain of public health organizations or your doctor or your local healthcare provider. That is the only way someone should get their shot. I guess one other way now, which is going to be increasing, I think, next month, is pharmacies.
Correct.
So pharmacies are going to be getting as well. But nobody who contacts you can help you get the shot, the vaccine. These are scammers. So in your mind, you should say to yourself, if you get an email saying that they can get the shot or move you up in the line, that's a scam every time. Not scam sometimes. It's a scam every time. If you get the robocall, if you get the text, if someone knocks on your door, we've heard that's happened in parts of the United States, going door to door with the scam. Wow. Anybody who contacts you unsolicited to talk about getting you the shot, in your mind, that's a scam every time.
Mm-hmm. And that's really important for our residents to know, and also especially for our seniors and our elderly. I mean, they really need to make sure that they understand and recognize when someone is reaching out to them proactively that it could be done in a nefarious nature and not for the right reasons. And so this is why it's important that we hear from Jim to make sure that our residents are aware that these types of scams, they are happening. They're happening across the country. They're happening across the state, across our region, and they could be happening here in Yorktown. But we want to make sure that you're educated so that when someone does call you or reach out to you or knock on your door, that you know how to properly handle it. Jim, what steps should our seniors take if they do, in fact, get contacted by someone? Obviously, other than just hanging up if it's a phone call, but should they be contacting the police department? What other steps should they be taking?
Well, the problem with contacting law enforcement is it's awfully difficult for them to combat organized crime that could be coming from anywhere in the world. Mm-hmm. So probably the best thing they could do is take down the phone number. They could go to our office. We'd have to take the information. They can go to the Federal Trade Commission or the Federal Communication Commission or the Do Not Call Registry. They're all online. They have a database where you can enter the phone number to get into the national database. But again, the thing you could do is hang up.
Right.
That's really the best thing because it's organized crime. They're very good at what they do. For instance, these phone calls, when you talk to organized crime, when you talk to law enforcement that's combated these organized crime, they will tell you that sometimes these phone calls bounce around the world from 10 different places.
Wow.
So it's very organized, super organized, and they know what they're doing. So that's why I preach all over the county. You have to protect yourself. Getting the shot. Nobody. That's not going to happen. So if you get that call, it's a scam, and hang up the phone.
Right. That's great. Again, this isn't the first time we've had Jim here to talk about these scams. And as he said earlier, we heard the same thing with taxes, and we hear them throughout the year. And I do hear of unfortunately residents, again, especially our seniors, who continue to become victimized because of this. And it's challenging. I can tell you that just the other week, my mother actually received an email from that seemed to be like an on sale for clothing for a brand that's very, very popular, and it was all extremely discounted. And so she went through and she was shopping along, and sure enough, it turned out to be a scam by the time she got to the end of the transaction. So we just have to be very cognizant of these things, and it can happen to anybody. It can happen not just to our elderly or seniors, but like I said, my mom, it could happen to me. It could happen to, people my age as well and our millennials, but you have to be cognizant of who you are communicating with and who you are doing transactions with.
Matt, there are scams that we have identified for teenagers. Yeah. Because there are sometimes teenagers who are always on the computer or the phone. They're easy to manipulate. So it's everybody in our society is victim of scams. Matt, can I add a couple things to your comment?
Please. Absolutely.
So one thing to be careful of, another scam that's out there relating to the vaccine, is that they're saying we have a product, like a certain kind of medicine or a pill or some kind of treatment that can hold off COVID until you can get the shot. So that's a scam every time. So there is no treatment or medicine that can stop COVID. It's only the vaccine. It's only, as Matt said at the beginning, social distancing, wearing the mask, don't go to gatherings. So there are people reaching out with fake medical treatment for COVID that's another scam to watch out for. Another thing I want to point out is, remember, when they contact you by email, by text, by phone, they're saying that they can get you the shot, and then they ask for a fee. The bottom line is the shot is free in New York State. So if you
Correct.
go to the county center, if you go to the health department or some of these pop-up places, it's free. So you don't need to pay to get the shot. That's
Exactly.
another way to know that it's a scam. And lastly, your mother's situation. One thing we tell people all the time is never, ever purchase a product based on an email or the unsolicited communication you get. If you want to buy a product, you go online and you go to the website, whether it's Amazon or Walmart or another 100 companies out there. You go to buy the product yourself. Never go based on a link on a website or an email you get. That's how you get in trouble and get controlled by the scammers. You take control of your shopping and you go to the websites. Make sure you're at the right website, but you go to the website and make the purchase yourself. Never rely on a link.
Yeah, that's great. All really great advice, Jim. I really, again, want to thank you for your help and for always being there to help our residents and our consumers and educating them to make sure that they don't become victims. And that's what we're trying to do here. And I know, again, people take advantage of specific situations. And right now, I hear from our residents every single day, people are eager to get the vaccine. They are very frustrated with the process. So, of course, someone's going to try to take advantage of that. And I want to make sure, and Jim and our county wants to make sure that people don't fall victim to that. And so it's really important, again, you never have to pay for a vaccination shot in the state of New York. Period. End of conversation. If anyone offers to do anything for you that requires a financial transaction to get your shot, it is a scam. Period. So it's really important for, especially, again, our seniors and our elderly and those who are qualified to receive the vaccination shots to know that. And we're going to continue to educate everybody as we go through this process. But again, to Jim's point, if you're on the phone, hang up immediately. If you're getting an email unsolicited, ignore it. These are all really important. Actually, delete it. But these are all really important steps to take to protect you and to make sure that there's no identity theft that occurs because people are trying to take advantage of a very serious situation. Jim, anything else you'd like to add?
I would just say this, Matt. The Westchester County Consumer Protection Office is glad that we have an advocate like you in Yorktown that's working with our office to get the information out to protect consumers. We enjoy working with you, and Yorktown's lucky to have a supervisor that's getting up to speed and getting information out to protect consumers. It's nice to work with you on that.
Well, I appreciate it, Jim, and I appreciate your leadership and your O's there. Whenever there's a question that I have or any of our residents have, your office has always been there for us and will continue to be there for us. So I genuinely appreciate your help and your guidance and your guidance specifically for our residents, because, again, we're trying to educate people so that they don't become victims. And
Sounds great. You also asked me at the beginning who I was rooting for in the Super Bowl.
Yeah.
I am a big Pat Mahomes fan, so I'm rooting for the Chiefs.
You're going Chiefs. Okay.
Going Chiefs.
And, Jim, what's the phone number for your office in case anybody needs you?
Sure. Best two ways to reach us. Phone, 914-995-2155. That's 914-995-2155. Or send us an email at conpro, CONPRO, at westchestergov.com.
Awesome. Thank you very much, Jim. It's always great to see you. And for our residents, again, I just want to say one more time, I know it's Super Bowl Sunday coming up. I know that everyone would love to be together, enjoying those hot wings and enjoying those commercials. Whether you're rooting for the Chiefs or you're rooting for the Bucks, it's best right now, again, to make sure that we don't fall victim to a false sense of security when it comes to COVID. It's still in our community. It's still, unfortunately, taking lives every single day. And it's important that we continue to wear a mask, social distance, wash those hands, stay within your COVID pod, especially during this very difficult time. So we're going to continue to provide information as it becomes available. We're going to continue to provide information on the vaccine as it becomes available. We're going to continue to fight to try to get more vaccines here in the town of Yorktown for our residents. If you ever have a question or a concern, you can always reach out to my office directly at 914-962-5722, extension 200, or you can also email me directly at mslater@yorktownny.org. Until then, Yorktown, stay safe, stay healthy. We'll talk to you soon. Thanks so much.